capillary pressure, PPC, remains greater than the alveolar air pressure at all times. Therefore, we can conclude that the blood flow through the apical part of the lungs is intermittent when flow during the systole, but stop of flow during the diastole. This is the called zone 2 blood flow. Zone 2 blood flow begins in the normal lungs about 10 centimeters above the mid-level of the heart and extends from there to the top of the lungs. Okay? And in the lower regions of the lungs from the about 10 centimeter above the level of the heart all of the way to the bottom of the lungs. The pulmonary arterial pressure during the both systole and diastole remains greater than the zero alveolar air pressure. Therefore, the continuous flow occurs through the alveolar capillaries or zone 3 blood flow. Also, when the person is lying down, no part of the lungs is more than a few centimeters above the level of the heart. Okay? In this case, okay, very important point, blood flow in the normal person is entirely zone 3 blood flow, including the lung apexes. Okay? In the lying position, there is just zone 3 regional blood flow. Pathophysiological of the zones of the lungs, there is a point of the key point is important. Effect of the exercise, for example, the blood flow in the all parts of the lungs may increase during the exercise. In the top of the lungs, the increase may be 700 to 800%, while in the lower parts of maybe 200 to 300%. This is because during the exercise, pulmonary vascular pressure rises enough during the exercise to convert the lung apexes from the zone 2 to zone 3 pattern of the flow. Okay, in the exercise, the blood flow is just similar to zone 3 pattern of the flow in the exercise. We have not zone 2, we have just zone 3 pattern of the flow. Zone 1 blood flow occurs only during abnormal conditions we mentioned before. Usually this is not seen unless there are two conditions. If an upright person is breathing against a positive air pressure and the intra-alveolar air pressure is higher than normal. In an upright person, pulmonary circulatory pressure is very low, as seen after severe blood loss. Taken together, we can conclude that this discussion, the zones of the lung and the differences in the regional blood flow, zone 1, zone 2, and zone 3. In the zone 1, no blood flow during all portions of the cardiac cycles. Pulmonary capillary pressure never rises higher than the alveolar air pressure, so the capillaries are crushed and the blood flow is greatly reduced. In the zone 2, intermittent blood flow. Intermittent blood flow during the systolic phase of the cardiac cycle, as in only to do the pressure and rise higher than the pressure in the alveoli. Okay, and pressure in the artery and pressure in the vein rise higher than the pressure in the alveoli. So arterial end dilated and open during the systole. Zone 3, continuous blood flow. The pressure are much higher than the pressure in the alveoli, pressure in the artery and the vein, and so the vessel dilated throughout the cardiac cycle and blood flow and its maximum. Pulmonary vascular resistance decreases during the heavy exercise. During the exercise, the blood flow through the lungs increase fourfolds, or sevenfolds we mentioned before, and again repeat that this one. This extra flow is accommodated in lung in two ways: by increasing the number of open capillaries, and some mention three ways, sometimes as much as three folds, and by distending the capillaries and increasing blood through each capillary by more than two folds. In the normal person, these two changes together decreases pulmonary vascular resistance so much that the pulmonary arterial pressure rises very little, even during maximum exercise. And we mentioned in the figure before. And pulmonary capillary flow dynamic is very important in the pulmonary circulation. The alveolar walls are lined with so many capillaries that the capillaries almost touch one another. You can see in the figure in the later, okay? Therefore, the capillary blood flow in the alveolar walls as a sheet rather than through the individual vessels, okay? You can see in this figure, you can see the surface view of the capillaries in an alveolar wall, okay? And we mentioned this, the capillaries almost touch one another. Therefore, a capillary blood flow in the alveolar wall as the sheet rather than through the individual vessels is connected together. And this here you can see this here. The alveolar walls of the extremely thin, and between the alveoli is an almost solid network of the interconnecting capillaries shown in the figure. We mentioned in the figure, we show that is here. And indeed, because of the extensiveness of the capillary plexus, the flow of the blood in the alveolar walls has been described as the sheet of the following blood. Therefore, it is obvious that the alveolar gases are in very close proximity to the blood of the pulmonary capillaries. You can see in this figure your respiratory unit, view of the alveolar and their vascular supply, okay? After cross-sectional view of the lungs, it is here. You can see this here is the terminal bronchioles and respiratory units, for example, in this here, and bronchial respiratory in this here, shows that, and capillary beds in this here, and alveoli and surrounding by the capillary beds. Okay, you can see in this here, the alveoli surrounding by the capillary beds. This shows also branch of the pulmonary veins in this year, and the branch of the pulmonary arteries in this year, and bronchioles in this here. As from this one and to this one, it shows the respiratory unit. We are many respiratory unit in the lungs. The length of time blood stay in the pulmonary capillaries from the histological study of the total cross-sectional area of the all pulmonary capillaries, it can be calculated that when the cardiac output is normal, blood passes through the pulmonary capillaries is about 0.8 seconds, okay? When the cardiac output increases, this can shorten to as little as 0.3 seconds. The shortening would be much greater where is not for fact that additional capillaries, which normally are collapsed, open up to accommodate the increased blood flow. Therefore, in only a fraction of the seconds, blood passing through the alveolar capillaries becomes oxygenated and loses its excess carbon dioxide, okay? Capillary exchange of the fluid in the lungs, pulmonary interstitial fluid dynamics. The dynamic of the flow exchange through the lungs capillary as qualitatively the same as those for the peripheral tissue. in the qualitatively, and quantitatively is different. Quantitatively, however, there are several important differences. One, for example, pulmonary capillary pressure is low, is about 7 millimeter mercury, compared with the higher functional capillary pressure in the peripheral tissue, about 17 millimeter mercury. Okay, this one differences. Another is interstitial flow pressure is slightly more negative than in the peripheral subcutaneous tissue. Values range from the about -5 to -8 millimeter mercury. The capillary permeability is high, okay, allowing extra amounts of the protein to leak from the capillaries. Therefore, the interstitial fluid colloid osmotic pressure is also high, averaging about 14 millimeter mercury, compared with an average of less than 7 millimeter mercury in the many peripheral tissue. And other differences, the alveolar walls are thin. The alveolar epithelium covering the vascular surface is so weak, it ruptures when the interstitial pressure becomes greater than atmospheric pressure. That is more than 0 millimeter mercury, okay, which allows dumping of fluid from the interstitial spaces into the alveoli. Taken together, for the forces tending to cause movement of the fluid outward from the capillaries and into the pulmonary interstitium, capillary pressure is 7. The interstitial fluid colloid osmotic pressure is 14, and the negative interstitial fluid pressure is 8, and total outward force is 29. Okay, forces tending to cause absorption of the fluid into the capillaries, just one forces is plasma colloid osmotic pressure is near to 28, and that is means total inward force is 28. Therefore, the normal outward forces are slightly greater than the inward forces, providing a main filtration pressure at the pulmonary capillary membrane that can be calculated as follows. Total outward force is plus 29, and in total inward force is minus 28.